Hello, everyone. I'm going to talk to you today about the principles of cancer development. Let's go ahead and get that slideshow started. If I can make it come up. There we go. All right. So, principles of cancer development. This is chapter 21, and it is for both nursing 491 and 492. So, our learning objectives today are to help adults identify behaviors that will reduce the risk of cancer development, teach adults the recommendations for screening practices and schedules for specific cancers, describe and develop the cancer cells and interpret cancer grading and stage reporting. So, cancer or oncology, which is the study of cancer, has its own unique set of terminology. I want to make sure you look at table 21-1 that compares features of the normal cell, the benign tumor, and the cancer or malignant cell. And that's on page 374. So let's start off with some just basic terminology. Neoplasm is a new or continued cell growth not needed for normal development or replacement of dead or damaged cells. Now, a neoplasm requires a blood supply with nutrients and oxygen. The strict process of cellular regulations controlling normal growth and function are now lost. Okay? There are two types of neoplastic cells. There's the benign. Benign cells are normal cells growing in the wrong place or at the wrong time. They are encapsulated. They do not have projections. They have smooth borders and usually will not return when cut out. The benign tumor grows by expansion. It does not invade. Does that make sense? So that means think of it like almost like a balloon or something. It continues to grow. So the tumor grows by expanding itself, not by invading other cells and taking them over. A benign tumor does more like just squishing things out. It does not take over the cell. It just squishes them or squeezes them out. Now, a malignant cell, they are abnormal and they serve no useful function and are harmful to normal body tissue. Malignant tumors have the ability to metastasize, meaning that they'll go to other places. Primary tumors is usually identified by the tissue from the parent tissue. Now, what that means is if someone has breast cancer and they're being treated for breast cancer and it is metastasized to the bone, they still have breast cancer that has metastasized to the bone. It is not considered bone cancer because when you look in the cancer cells that are located now in their bone, they actually are still breast cells. Okay? So, metastasis occurs when cancer cells move from that primary location and establish remote colonies. Okay? And those are called secondary tumors or metastatic tumors. And you want you to see page 375. So that means that there's still, I'm just going to use breast cancer as the example because that's what we're talking about more later today. So when breast cancer metastasizes to, let's say, to the bone, because breast cancer generally goes bone, brain, lung, you will see that when you look at the cancer cells inside the bone at this point or inside the lung, they are still have some of the features of an actual breast cell. So they have metastasized to other locations. It hasn't become lung cancer. It is breast cancer that has metastasized to the lung. Okay? When you look at metastasis, it's spreading of the cancer cells through either the circulatory system, the lymphatic system, or a direct incision. Common sites of cancer metastasis are with brain. They'll have headaches, seizure, and vertigo. when you have when it invades the respiratory system, it's cough, hemoptysis, and dyspnea. And you can see some of the other reasons when the people have metastasis to these areas, the symptoms that occur. On table 21-2, it talks about the common sites of metastasis, and you will be responsible for where breast cancer metastasizes to, where lung cancer metastasizes to, and where colon cancer metastasizes to. Okay? Those are the three that I want you to be most familiar with. But that table is on page 375, and it's table 21-4. So what is cancer classifications? As I said, oncology has its own unique language, and this is part of it, and it's the cancer classification system, where cancer originates and then it's staged according to severity, and it's graded due to malignancy. Okay? The different systems are with different cancers. Staging is the exact location of the cancer and its degree of metastasis. Maybe 1 to 4. Smaller cancers and less spread, greater the chance of treatment will result in cure, clinical, surgical, or pathological. On page 377, for grading, this will have to do with how aggressive or how malignant cancers are. Barely resemble tissue and are aggressive, they spread rapidly, would be a very high grade. Okay? Very aggressive tissues, and they're very poorly differentiated between the other cells. Growth assessed by double time and amount of time it takes for a tumor to grow. So basically, what you need to know about the cancer classification system is that there is a classification system. That stage 0 is the carcinoma, is very small and it's in the early stages of forming. Stage 1 is localized. Stage 2 is localized but advanced. And that stage 4 means that it has metastasized. So basically, just know that the stages go up. And I do want you just to know, basically, this slide here, I'm on slide number 5. That's going to be just knowing just that little bit of information, just enough so that when a patient tells you that they had stage 3 breast cancer, you're aware of where that has gone. And when they tell you that their breast cancer has metastasized and they had treatment, you know where that treatment would be. But that's all. There's a lot more about that. But as far as I'm concerned, for testing purposes, that would be, you're responsible for that slide 5. That's a beautiful picture, and it'll tell you what you need to know. So looking at assessment, external factors that can cause cancer. It can be chemical carcinogens, physical carcinogens, or viral carcinogens. 80% of cancer in North America are caused by environmental exposures, which include chemical agents such as tobacco and alcohol. And a lot of our elderly gentlemen were exposed to Agent Orange in Vietnam, causing different types of cancers, including prostate. Physical carcinogens cause cancer by damaging DNA, such as radiation, like sunlight, or the tanning beds that I spent way too much time in my youth, and chronic irritation. Radiation is the most common cause of cancer caused by the UV light, okay, and that is skin cancer. So, again, that would be people of my generation who spent way too much time baking in tanning beds. Chronic irritation are suspected to cause cancer, for example, in adults with burn scars. And they say that, what I was reading further in the chapter, it was talking about how those, because it's a scarred tissue, they don't develop as well, so they have more of a likelihood for abnormal cells. Viral carcinogens occur when viruses infect body cells and break down DNA strands. There's some examples on table 21-6 to look at what different cancers can be caused from different viruses that we can have. But basically, I just want you to know for assessment purposes, what a chemical carcinogen is, what a physical carcinogen is, and what a viral carcinogen would be. Does that make sense? As far as knowing the very specifics, not so much. Just know that with physical carcinogens, I would be talking about radiation with the UV lights, okay? There we go. So going on with continuing with assessment, personal factors. What causes people to get cancer? There's all kinds of things. Immunosuppression, advancing age. Chart 21-2, you should really already know this. We have already covered it in other lectures, but you will need to be responsible for 21-2. Other reasons that people get cancers, it can be genetics. So these are personal reasons that can cause or lead to cancers. Cancers incentives increase when immunity is decreased. Advancing age is the single most important risk factor for cancer. Again, advancing age. Okay? This used to be a mnemonic that the Cancer Society used a lot. It's still posted in our book, so I did want us to look at it. It's patient education, the 7 warning signs of cancer, and it would be changes in their bowel or bladder habits, a sore that does not heal, unusual bleeding or discharge, a thickening lump in the breast or elsewhere, indigestion or difficulty swallowing, an obvious change to a wart or mole, or a nagging cough or hoarseness. Now we know because we're far enough along in this course that that can be a lot of different things, and it can be. But we also want to make sure that if people are having these symptoms, that they contact their healthcare provider to have them further looked at. For instance, they may be having unusual bleeding or discharge because of endometriosis. I mean, it have nothing to do with cancer, but they still need to have that looked into. They may be having more difficulty with a nagging cough or hoarseness related to GERD. But again, they need to have that looked into because these can be warning signs of cancer, and it's important that people have those looked into. I am on table 21-7 on page 380. Oops, here goes. So interventions, patient education prevention. So a lot of times lifestyle changes can make a difference. We need to be able to identify high-risk groups. There are screenings. They need to make sure that people go for their annual physicals and do self-exams, whether it's testicular or breast. Primary avoidance of known potential carcinogens. Modifying associated factors appears to help with risk factors. Remove any at-risk tissues, for instance, moles or polyps, or sometimes people will actually just remove the entire breast. They may have had so many benign little fatty tumors that they choose just to have the breast removed. We also want to make sure that we know our screening times. Know your ages for yearly mammogram. Choice for annual is 40 to 44. Annual is 45 to 54. And biannual, which is every other year, is over the age of 55. Also, you have to know the age for colonoscopies is 50 years of age and every 10 years afterwards. These are very important, and I want to make sure that you are aware of those because no matter what area of nursing you go into, it's going to be essential that you're able to help your patients to remember if they need to have those screenings done. So that is chapter 21 in the nutshell. All right, and we'll be back with chapter 22.